I was looking at it from a pediatric perspective as more time went on. I saw a number of kids, many, many, many kids and for the most part, they all had minor cold symptoms, and that was it. I didn't even know. I would get a call a day or two later after I'd seen a patient, and the child would have to have a test for some travel reason or something, and they would report to me, "Oh, the patient you saw yesterday had," and they were in for a well exam or something, you know, not related to infection. And so, in the early years, early months of this, I had maybe one or two patients that went to the emergency room and they were there for a couple hours and were discharged home. I actually had no patients personally that were admitted to the hospital during those first few, I would say the first 6 to 7, 8 months of the pandemic. It just, the majority of the kids were absolutely fine. And we have seen that in the statistics from our CDC. Your otherwise healthy child has essentially a 0% risk of dying from. Now, it's not fully zero. There's a very, very, very rare possibility, but it's actually really low for kids. Kids were spared in terms of fatalities. Now, could they be admitted with? Sure. Like any other respiratory virus, they could certainly be admitted with dehydration or respiratory issues or things. But the fatality rate in kids was extraordinarily, fine. It was just as much as other viruses. And what began to really worry me as we went from this idea of 2 to 3 weeks of flatten the curve so that we don't overwhelm hospitals, we morphed into this idea that thou shall never get a virus again, and that we're somehow going to have to protect our kids from getting any virus and from getting sick. And it's impossible. Every year, kids get viruses. Every year they're hospitalized. And we've morphed into this idea that we have to keep kids safe from any sort of an illness. And that is not where we want to be healthy going forward. Yeah.
Right. And not only is it not realistic,
Yeah.
like you just said, it's not healthy. I mean, kids,
Emotionally, it's not
yeah,
healthy.
emotionally, yeah, and even immune system wise. I
Yeah.
mean, our immune systems need to be exposed to things. That's okay because that's how our immune system works.
Yeah, it's not only okay, but it's actually vital to how your immune system works.
Exactly.
A kid who's roaming around in a barn and digging through the dirt and just having a good old time with their little toy tractor in the mud, is generally speaking a lot healthier than the kid whose mom is, sterilizing every bit of anything around him and won't let him touch a cat or a dog or or go outside and play. Our immune systems have to be trained, and they also have to be trained by getting sick. So it's a very complicated system, our immune system. But the idea that we somehow bubble wrap our children and keep them from ever having anything is clearly not realistic, and it's really harmful to their mental health. So I began, as time went on, to see these kids coming into my office just terrified. I mean, terrified to the point where they wouldn't take their masks off. And I would have to ask them to do that for just in the early months of this, just to be able to see their throat, of course. And of course, I didn't mind if they didn't have it on at all, but that wasn't up to me. That was up to my employer in the office. And, but I would have to ask them to take their mask off to see their throats. And they were just really quickly off, back on again. I mean, so terrified and so linking that mask to somehow their safety. The mental health of our kids was really, really, really harmed during this whole period of time.
Yeah, we were traveling one time. Actually, I think it was to Palm Springs, either
Mhm.
last year, year before. I think it was last year, and we were in a retail store, and the gal had a kid that was like 7 years old, and she said for the first time ever, he'd been in school, public schools for a couple of years, and she said for the first time ever he'd seen the kids in his classes faces. They'd never seen their faces for 2 years because they had masks on.
Yeah.
That can't be healthy. That can't be healthy.
No, our kids' development it was a big setback to the development of our younger children. And I could see it on the babies. The babies would, they would try to look at their mom with a face mask on, and they just would be no reaction to their mom because they're looking for her face, they're looking for her mouth, they're looking for the other facial features, and they just would look so puzzled, like, Where is this person? What is that? It was, when if I had told you before this pandemic that parents would be fearful of a virus that ultimately had a 0.0027% chance or 0.0003% chance of killing their child, of causing a fatality, we would have just laughed because it's such a statistically low number. What parent would have ever said, "Oh, that makes me fearful?" But this is the power of propaganda. The propaganda, the fear that was pushed out, on the community, because there is no worse fear than any parent has than something happening to their child. Let's face it. Those of us who are those people who are parents, you know, that's the fear they have. And to the fear was used in a way to make people give away their rights and to put masks on children that were harmful to them. They're harming their kids, definitely emotionally. Many of them had physical manifestations of that with belly pain and anxiety and just shaking. And you know what happened to children based on such a statistically low chance of anything terrible happening them from the virus was just sad. Was just sad. But I know the
Yeah,
parents doing this were not doing this. They were doing it because they were truly fearful. So the propaganda was very powerful here. Yeah.
yeah, and they were just kind of following orders because they thought that's what was right. And
Yeah.
unfortunately, I think a lot of people in the medical field, even if they thought different outside the narrative, they were so scared to stand up. There's not a lot of pediatricians like you that were going to stand up and say, this doesn't seem right. So they would just follow whatever their pediatrician said. And speaking of that, many pediatricians are recommending the vaccine for kids. So what I think you have a strong opinion on that. Well, what are your thoughts?
I think that a parent truly has to make their own decision about it, and to do that, they have to have an informed consent discussion with their physician, and that is really not happening. The physicians have been we've been threatened, been silenced, and many of my colleagues have been silenced, and they're absolutely not having those informed consent discussions the way that they need to be with parents. At this point, the majority of children have had have already had the infection. So, and again, as we've already discussed, that their risk from this of a fatality from this infection is so extremely low that the parents need to know that number. And then you have to balance that with the risks from the injection itself. And I don't call it a vaccine. It actually, the definition of vaccine had to be changed for this product. It's a completely different type of a product, as you know, because you're a pharmacist. This is not your traditional childhood vaccine. This is a genetic, biologic agent that has never uh, been used before in such a mass scale in human history. And we don't know, nobody knows the long-term consequences of receiving this. And if you look at the CDC website, there is a clear list, and we have seen it play out in society, a clear list of side effects. So one of which is inflammation of the heart muscle. And I already have direct knowledge of more cases than I should know about of kids with myocarditis that are related time-wise to having received this injection. How in the world can we support a product that it appears from all the literature out there, all the scientific data out there, has a much higher chance of harming your child than helping your child, i.e., the risk clearly, clearly looking at data so far outweighs any potential benefit if there is one. And again, you're giving a product that is for an outdated, the virus is mutated since then. So it's a variant
Right.
now that, so you're not even protecting anything with this. And so my question is, what is the risk benefit ratio? And other nations have shut this product down for their young people. And the average American citizen does not know that because mainstream media is not telling them. But other nations have shut this down. It's no longer offered to younger people. And by younger people, some nations have actually defined that as anyone under 50. So we're not just talking about the pediatric population, we're talking about anyone under 50 in many nations, as their scientists have looked at the same data. And here in America, we are being asked to basically be quiet and not even have that conversation. So how
Yeah, I think it's
scary is
England. It is right. It is scary. It's England,
it?
right? Is it England that's in no longer is
There are
recommended for anybody?
a number of nations looking at it, Scandinavian countries, England, Japan, Thailand. A lot of nations are looking at this very, very strongly and have varying, policies in terms of who they will allow to have this injection at this point. And the very idea that we are just silenced from even asking the question. But look at the CDC website. It actually lists myocarditis. It lists other complications from this product. It actually even mentions fatalities. Yes, there have been autopsy proven fatalities linked to administration of this shot. And for those families, did they have an informed consent discussion? No, I've actually met one of those families, actually several of those families, and they wish that someone had told them what these risks might be. We've never had a product like this where we've been silenced and kept from having a discussion. Look right now, like last week, I think there, probably better about this than I might, but they just pulled or restricted the use of an eye drop that was causing infections in people. You might have seen that, and just a handful of cases. And they've pulled the product from the market, as they should. No one wants to use an eye drop that is going to cause you a serious infection. Here we have alarm safety signals going off like crazy, and we're for the shot, and we're told to be quiet, and our licenses are threatened. It's just absolutely surreal that this is happening in America.